St James's Hospital, inner city, Dublin. One of the country's biggest and busiest hospitals.
You did really well.
Big breath in, please.
Over 400,000 patients are treated here every year for a huge range of illnesses.
I was diagnosed with HIV. I thought I was going to die of AIDS.
Here, life and death are daily realities.
Oh, God. Pressure is pretty low.
You bring your A game.
Security at the ambulance bay doors, please.
From the front line to the back office, hard decisions have to be made.
The hospital is full. There just physically isn't anywhere to put these patients.
And the pressure is always, always on.
It's a national emergency.
I'm only 31, I might have had another kid, and I think that I wanted to be the one that made that choice and not the fact that I got the cancer.
2 months ago, mother of two, Tracie Doolin, was diagnosed with cervical cancer. Today, in the hope of beating the disease, she will undergo a radical hysterectomy. Her cervix, uterus and fallopian tubes will all be removed.
Emma's in 5th class. She only asked me one question when I told her, "Mammy, are we still going to Blackpool?" And then I have a 3-year-old as well. He doesn't really understand. I kept telling him that I have to go into the hospital to get surgery, and he says now that he's gone to the hospital and he wants to get surgery too.
Oh, Tracie, come on in.
Thank you.
Tracie and her mother are meeting with consultant oncologist Faraz Abu Sadeh, who will perform the complex surgery.
How are you?
Good, yeah. A bit nervous, but... Hi, how are you?
Now, the principle of cancer surgery is 2 things. The first principle is to remove the cancer that we know it is there.
Clear
so we need to remove the neck of the womb, the cervix.
Yeah.
The second principle of cancer surgery is to remove margin around the cancer to make 100% sure that all the cancer is taken out. But the cancer sometimes is a little bit more tricky. So instead of spreading to the neighbors, to nearby structures, it may make a big jump and it will go to what we call the lymph
nodes, yeah.
So we'll take the sentinel node. We send it to the lab, and that sentinel node will be examined immediately under microscope to see if there is cancer or no cancer. Because remember, if there is cancer in the lymph node, surgery is not going to cure the cancer for you.
So you will stop the surgery then?
Absolutely. Write your name here, Tracie, if you are happy, and your signature here.
Okay, perfect.
Tracie's hope is that her cancer will be fully removed through surgery. If not, she faces a very uncertain future.
Can I have 2 up to try it? Is that okay? I'll get an attendant. Okay, this is go home. You have to leave. Sorry, I love you, but no. You're not bad. Look, you like your job, so you hang around, and then bad things happen.
It's early on Saturday morning. Site nurse manager Roz Gillen starts her shift and is briefed by the night manager. Roz's job is to keep the hospital clinically safe for the duration of her shift. Staffing is her first priority.
Transition's open with 8.
Oh, no.
ICU have 2, but staffing is a huge issue for them this morning. There's lots of areas short. Not a good day. Be good. Bye-bye. Take care.
I don't think I've ever come in that everywhere is covered. I don't think that's ever happened. And I've been doing this job for 10 years, but I don't think I can remember that every shift was covered. That just doesn't happen.
To help bridge the staffing gap, St James's Hospital hires agency nurses and healthcare assistants to ensure the hospital is adequately covered.
Maria, will you go to hospital 4?
What's your name again? Pamela. Yeah. You know, there isn't a full agency supply. We would never get the amount of nurses that we need. But of course, there are budget restrictions as well. It's not like, come on in, everybody, like, you know, that.
As Roz begins her shift, the hospital is full to capacity. 3 heart attacks arrived in overnight, requiring the overflow unit to be opened to cope with other patients. The single nurse staffing it is now ringing for help.
Hello, good morning.
Hi, it's Roz here.
Hi, Roz. This is
Yes.
Beatrice.
Oh, hi, Beatrice.
I'm really in trouble with all the medication. It's all over the place. My God, it will take time for me. But they're all crying for the medication.
So no chance you can come in today. So that's not good. She's on her own down there, so she's obviously going to need a dig out. I have to kind of make sure that everywhere, to the best we can, is safely staffed. Can you check it out for me? But I am going to have to take somebody. You know, that unfortunately means taking people and moving people and leaving areas short and prioritising other areas. And no one likes doing it. I hate doing it. But yeah, has to be done.
Say all for me.
All for you.
Not in a blanket in the place, and that's her. Give it to the needy first. Yeah, there you get it. Go get that in the aggression.
The National Maxillofacial Unit is located at St James's Hospital. Here, they create new eyes, noses and ears for people. Today, Tim O'Neill and his partner Kerry meet with consultant professor Leo Stassen.
Right, you've been referred up from Waterford. You had an operation on your ear. That was some time ago, is that right?
It was, yeah. It was all last year, 2017.
Okay. And your surgeon down there is happy with everything?
Yeah, I've got the all clear now, thank God. Yeah.
Oh, that's excellent. So you've had the glands removed from your neck and you've had most of your ear removed?
Yeah.
All right. You wear your hat. Do you always wear your hat?
In public, yes, I do, yeah. I just think it's quite obvious that I'm missing an ear, and you get a lot of questions asked about what happened, and it's just, I try to avoid them questions then.
Right, do some people think you were involved in a fight or anything? Or?
It could be anything, yeah.
My colleague, an ENT surgeon in Waterford, removed his ear here for a squamous cell cancer, which is a form of cancer on the ear. He's removed the glands in his neck through an incision down here, and he's taken a graft which has been placed here, and now we have this portion of the ear left. The chief maxillofacial technician, Niall Murphy, I'm going to ask him to come in as well, if that's okay. Yeah. The reason being is we do this jointly together. Is that all right?
That's perfect. Yeah.
All right. I need you to go over there. I need you to go over there now.
How you doing?
That's great.
Rather than making 3/4 of an ear, you'd be better off making a full ear to wrap around this tragus here and tuck in under here. And the pins that we're looking to put will be probably one here and one here. I can feel the bone already. 2 metal pins, and that's all that'll stick out. Okay. And then on top of the pins we'll go stick on your new ear.
Chief maxillofacial prosthesist Niall Murphy makes a mould of Tim's good right ear. Okay. This will be used as a guide to create a new left ear.
Kind of got used to it, family, friends, everyone, supportive, everyone, especially Kerry, who was there the whole time. Scarring and losing salivary glands is a small price to pay for your health. You mean to be healthy and stay alive. And that's pretty much what you're trying to do.
Like some jelly and ice cream, cake and custard.
That's the family room here where they get all the bad news, which is right in front of kitchens. It does be very sad.
I love coming in when all the plates are empty because I know then they're enjoying it.
And then they'd be waiting patiently for the dessert, the jelly and ice cream. There you go.
It's 7 a.m. Tracie Doolin waits to be taken to theatre for surgery, which will remove most of her reproductive organs. However, this radical operation may not be enough to stop the spread of her aggressive cervical cancer.
I'm awake since about 4. The hospital's always really noisy and bright and too bright. So I'm going down. They said surgery's going to start at 9, so it will be about 4 hours the operation. So hopefully by lunchtime I'll be awake. So yeah, it's very daunting.
Tracie's operation is presented in the daily multidisciplinary team meeting. The MDT includes all of the staff involved in Tracie's care.
Tracie Doolin is our 31-year-old. She's a new diagnosis of cervical cancer. She is stage 1B1. She's a para 2 and is well medically. She's very anxious this morning, but we've reassured her and she's first on our list.
This is the anaesthetic room.
Thank you.
You want to see the hypnotist?
Morning.
How are you?
You okay?
Free.
Fine.
We get over it.
Did you have any sleep last night?
A little bit.
I'm sure you'll be fine.
Okay.
A couple of hours you'll be awake and you'll be over.
Okay, thank you.
Thank you. Morning, Tracy. Can I look after you well, okay?
The first part of Tracie's operation is to find out if her cancer has spread. Tumours that spread first drain into a patient's sentinel lymph node. The node provides an immediate clue. Mr. Faraz must first locate and remove the node, which will then be analysed immediately by the pathology lab.
It's lovely over, isn't it? Thank you very much, that's great, that's perfect. That's the uterus. At the side of the uterus, always there's 3 ligaments attached, or 3 structures. You have an ovary, ovarian ligament, femoral end, fallopian tube, and round ligament. But the first step here is to open the pelvic side wall and to look for the sentinel lymph node. Send that for a frozen section to see if there's disease in the lymph node or no. And if there's no disease, we'll progress to radical hysterectomy. If there's disease, then she'll be treated with primary chemoradiotherapy. Okay? Let's go back to this side and see if we can find it. Okay, zoom out. To green, to green. Great, okay, we'll take the first
After 1 hour of surgery, the team have located the node.
That's nice sentinel node, yeah? Okay, Angelica, this is the sentinel node. Yeah. If you send it for the lab, please.
Straight again, please, Sam.
This is a critical stage in the operation. Surgery is halted, and Mr. Faraz and his team will wait while the node is rushed to the pathology lab for testing.
No, yeah, thank you so much.
The sentinel node is frozen and sliced by the lab before analysis by consultant histopathologist Ciarán O'Riordan.
Okay, Rona, so shout if you see anything abnormal here. All this blue darker area is lymph node, and what we're looking for here is any small metastases, any involvement by the known tumour.
If the cancer has spread, the operation will be abandoned, as surgery alone will not be enough to help Tracie. Cervical cancer patient Tracie Doolin has been in theatre for 2 hours now. Her radical hysterectomy has been halted as the team wait for a call from the pathology lab to tell them if Tracie's cancer has spread beyond her cervix. If the cancer has spread, the operation will be abandoned, as Tracie's chance of beating the disease is greatly diminished.
Hi, Angelica. This is Ciarán O'Riordan in pathology with a frozen section report for Mr. Al-Rusadi. Thank you.
Firas, it's the frozen section now. Would you mind to answer the phone, please? Thank you.
Okay, thank you.
It's Claire here.
Hi, it's Claire.
Hi, Claire. This is Ciarán here, just with a frozen section report on Tracie Doolin.
Yes, please.
Yes, so sentinel lymph node is negative for malignancy.
Oh, that's great. Thanks so much, Kieran.
Can you just call that back, Claire? Sorry.
Yep, so sentinel lymph node is negative for malignancy.
Thank you very much.
Thanks so much, Kieran.
Thank you. Bye.
All good? Great. So now we will progress her radical hysterectomy. With radical hysterectomy means removing the uterus, cervix, parametrium, and upper vagina. So this is the cancer here, inside the cervix. And you see we work, we didn't go close to the cancer. We leave at least 2 centimeter margin all around to make sure that all the cancer is taken and nothing is left behind us.
Although Tracie's tumour has been removed and early indications are that the disease has not spread, it will be another week before detailed pathology tests can confirm she is cancer-free.
much do you smoke a day?
About 40.
40, jeez.
I told you, man, I smoke 40 less, not 60. I told him 40. Well, it's not about 60.
Amy, how are you?
See anyone's going home today?
No, not so far.
Not so far. You give me a shout.
How are things here?
And then we've a gentleman with 6 sinus syndrome in number 5, so cardiology haven't seen him yet.
It's all cardiology, isn't it?
Yeah.
Potentially we need 3 ICU, well, 2 CCU and 1 ICU bed.
Site nurse manager Ros Gillen is just 2 hours into her Saturday shift. The hospital is full and staff are under pressure.
How are you? Oh, we're doing what you can, so
Oh, no.
God, I don't know what's going on.
All right, okay, we'll
You
get
can
somebody.
somebody.
Yeah, no, I will, but it's pulling from somewhere else, obviously, because I don't have any staff. But anyway.
Ros herself is relieving the nurse who has been managing the overflow ward on her own now for 5 hours.
So I'm here to let you go for your break and things. This is the transition unit, so this is an overflow area that is open when bed capacity is full around the hospital. We don't like when it's open because we try to keep it closed because a few staff that you might have are taken from other wards to cover it. Now, there you go. Go on, get them into you. Don't have all day.
Another heart attack, called a STEMI by staff, is on its way.
That bleep, it's just switch.
The fourth in the last 4 hours.
For the same thing. That's grand. Okay, so 20 minutes. Lovely. Thank you. Bye-bye. So that's a STEMI call in 20.
This places huge pressure on Ros. These are life and death situations, and her job is to ensure there are enough coronary care beds and staff to cope.
We have to be ready. We have to be able to accommodate people as they come in. We can't tell them when they're going to have their heart attack. So, yeah, that's it. They're saying about 20 minutes. So just need to make sure that we have a bed for them afterwards.
Cake sale! Cake sale!
Hey, this is from my children, not mine or wife. Let me tell you how on to them.
Yeah, of course, yeah.
Don't put them on the right here.
Show us the skinny ones, will you?
The skin. She likes what?
She likes chocolate. Not dark chocolate though.
Low fat, of course.
Hi, this is Sandra. Can I come in, please? Thank you. So most of the time it's all hygiene the whole way in here.
Today, like every day, Sandra Podreski is visiting the Dennis Burkett ward. This ward has the highest level of isolation in the hospital. Patients here have low to no immune systems, and the slightest infection could be fatal.
Everything is sealed off, so one door has to close before you can open the next. They won't work otherwise.
Sandra's daughter, 28-year-old Chloe, had a stem cell transplant 9 months ago for a rare disease of the bone marrow called aplastic anemia. She's been in hospital ever since.
Hi, Miss Chloe.
Hi.
I'm good. How are you today?
I'm fine.
Yeah? How are things?
Good.
Good. As you can see, it's the biggest room in Burkett's. It's a fabulous room, even if she's here by herself. I came in and slept with her over Christmas, so I have my own bed in here, and we had a great time. Are you happy in here, Chloe?
Yeah.
Yeah.
I know it's long and that, but I'm getting there slowly.
Yeah.
But other than that, I'm doing very well.
But regarding people being in this unit, I think you're nearly the longest.
I'm the longest running patient in here.
But in that period of time that Chloe's been here, 5 close friends have passed away.
There was a guy upstairs, and I got on very well with him. Very well.
He used to call you?
Tinkerbell. That's my sister-in-law Tara and her wedding. And that's her 2 sisters and myself as bridesmaids. The first time I got my hair shaved, it was actually in here. And I remember just sobbing my eyes out when they were shaving it, because I didn't really know I knew what they were doing, but just letting them shave it was really upsetting for me. When it was falling out, I was actually lying in bed and I could feel it coming out.
Yeah, but it's back.
And that was it now. I just miss being at home There's a certain amount of time I have seen at home.
But your room is still there.
And no one's getting my room.
No one's getting your room.
Nobody's getting my room.
She's a special needs girl. She's a rare genetic syndrome. You know, she's been through, she's had such a tough life all her life. I kind of, as I say, I wish it had have been me. She really is the strongest one, I think, of all of us.
When I'm sitting here, I have loads of time to write poems and that. My nan passed away just before Christmas, and I really miss her. My nan and I are going to see Nathan Carter on the 23rd of March. I'm really looking forward to it. Hoping to go.
You're hoping to get a day pass and get out of here for a little while to go to the concert.
2 years ago, Tim O'Neill from Waterford was diagnosed with skin cancer. His treatment required the removal of his left ear. Today, he faces further surgery, but this time for a more positive end, a new ear.
Well, today I'm back up in St James's, my 4th surgery, hopefully my last.
This is the one that we're looking forward to the most. It's nerve-wracking, it is a surgery, but it's the last surgery, hopefully, that he's going to ever have. It's the end of a journey. It's all the bad we went through. It's like the light at the end of the tunnel.
Today, Professor Leo Stassen will drill 3 titanium implants into Tim's skull.
Is that okay?
This is the first step in a process to attach a prosthetic ear. It's a delicate process that requires exacting measurements.
Now, Tim, if you feel anything, will you let us know? So the first thing we're going to remove is this little lobe of your ear. I want to keep some of the skin to help me close it. Well done. So that's the bit of the excess tissue gone.
Our next step is to put in the 3 implants. Okay. So the hard stuff is done, so it's a bit easier from now on, okay?
Okay, thank you.
Tim, this is a special drill bit. It's actually set so I can only drill to 3 millimeters, and that's because the bone is very thin here. Is that okay? Thank you. Nice and slowly.
30 minutes into the operation, Professor Stassen encounters a problem.
Now, that's not good. So I'm not happy with that hole because it's going in too deep, so we have to change that position there. So where else would you like me to put it?
There, just where you are. Yeah, better. Try your best there.
Okay, no problem. Try that.
There is constant consultation between Professor Stassen and Chief Maxillofacial Prosthesist Niall Murphy.
Let's have a look and see what that one's like.
They must protect Tim's skull while also finding the best position for the implants.
Nice and steady, everybody. I don't know that it will tighten. I think the problem is it's loose. I don't think we should leave that. So we need to find another place. Okay, well done. Now we've got 3 very good solid places. It does mean that Niall will need to modify what he was going to do, but we've got solid places, which is what we need. There we go. All right, so there are the 3 implants that you can see very nicely in place and down. Great.
In the last few hours, 4 heart attacks have come into the hospital, and it is site nurse Roz Gillen's responsibility to find coronary care beds for all of them.
Hello, it's Roz. ETA 45 minutes from Wicklow. What time is it now? Okay. Thanks a million. Thank you. Bye-bye. Oh my God, that's another STEMI call.
St James's is a specialist centre for heart attacks and takes critical patients from much of Leinster. However, to keep beds available, patients have to be transferred back to their regional hospitals once stabilised.
Nace are saying they don't have a bed.
Well, I just put up 7. 2 patients you take?
Yet either. So there are 3 to go back to the hospitals.
Today, the regional hospitals are also under pressure as Roz tries to arrange the transfers.
Is there any movement? We're absolutely out the door here. everywhere has their own bed issues, everyone has their own urgencies, and you are trying to deal with what you have here in front of you now. And is there no one that can come out of a room if patients aren't repatriated back to it just comes to a standstill. Like, you know, there isn't a never-ending capacity here. I'm just ringing about a patient that was for transfer, and the ward have been speaking to the bed managers there, and they've told them that there isn't any beds for the patient. It's just the whole knock-on effect that it has on the programme if we can't get the patients back. So unfortunately, like, we're kind of left in the situation. I understand your bed issues as well, but unfortunately, this one has to take the priority. I know, and I do get that. No. Oh, I absolutely appreciate that, but at the same time, the patient has to go back. There really isn't, you know, a choice. Thank you. Bye. Oh dear. Every other hospital is probably in the same boat as us. They don't have the beds, and, you know, there's, I wouldn't say a reluctance, but like maybe, you know, just not as urgent to get the patients back, you know, to their hospital. But for me or for here, that was a big urgency today, because otherwise we're not going to have the beds to take the next patient that comes in. Like, there's never enough beds. There's generally never enough staff. Yeah, different every day, so surprise, you never know. Hi, how are you? There's she going. I recognise the steps. So 2 more STEMIs. Yeah, I couldn't get beds in Drogheda or Naas. Trying to get them back is like
a nightmare.
Yeah. Okay, Yvonne, I shall see you in the morning.
See you in the morning.
Yeah. Thanks, Yvonne. Bye. Okay, see you. Bye.
Catch rescue mission. Alpha A2 control. Cat has been released for a happy life.
It's a week since Tracie Doolin had radical cervical surgery. Today, she's going home. She faces an anxious week before pathology can confirm that her cancer has been fully removed.
Well, now it's good. It's really good to be going home. I don't like it in here. So, no, I'm delighted now. My mum's on her way in to get me. That'll be good.
How are we?
Hi, I'm good, yeah.
You
thank
good?
God.
Great.
Still alive.
What about this? Ready for home?
Yeah, I can't wait to go home.
You
now.
sure?
Yeah, I'm really looking
No
forward
issues?
to it. Pardon?
No issues?
No issues. They've been really good. They've explained everything really well.
So take it easy. Please allow the people around you to help you and to mind you.
Yeah.
So no lifting heavy things, nothing major, cooking, shopping, hopefully.
No hoovering, thank God.
No, please, no.
Yeah.
Don't clean the windows, anything
No,
like that.
I won't have to. No.
For 6 weeks. We should have the result by early next week. Maybe we have it by Monday when we have our cancer meeting.
Brilliant.
So if I have it, I will call you. Look after yourself, and I'll talk to you Monday, and I'll see you on Tuesday morning.
Perfect.
All right.
Thanks for everything.
Thank you very much,
Take
Tracie.
care.
Bye.
Right, bye.
Anja, good morning.
Just create some really crystal clear sound.
Hi, Mary.
Sandra Podreski is making her usual daily visit to daughter Chloe. Chloe is one of the longest stay patients in St James's. 10 months ago, she had a stem cell transplant which has not, as yet, proved effective.
She's not in good form.
No.
Very quiet. Not in bad form, like, you know, very quiet herself. Yeah.
Hi, Chloe.
Hi, Mum. How are you?
I'm good. How are you?
Good.
Good. She's supposed to be going to see Nathan Carter on Friday night, and she's not allowed out of hospital for a few hours, so that's a bit of a disappointment for her. Maybe that's why she's been as low as she is the last couple of days. Are we going to go out the front for a while?
No.
Just for a little while?
No.
Why not?
Because I'm not in the air with the group.
Why?
Because I'm just not out already.
Okay, I suppose that's good enough. And you're just not hungry or thirsty?
No.
It's incredible, Miss Chloe.
I know.
She's coming up on 10 months in hospital. She's in a room by herself and she's only 28, she'll be 29 now in July. And it's soul destroying watching her. She's lost 40 kilos in weight also.
It's just the way it is.
Yeah, you just don't feel like food?
No. But my arm is still sore though.
But they still don't know why?
They still don't know.
Chloe still isn't up walking and she isn't in any way independent. So I kind of don't think she's going to make Easter. I had kind of said all along maybe May. What about your Nathan Carter ticket?
I don't know.
No joy?
I wanted to go, but I'm not able.
No. You're disappointed?
A little bit, yeah.
Well, look at this.
What?
Hi Chloe, Nathan here, just dropping by to say hope you're feeling okay.
Oh my God, can't believe that.
We'll see you at another gig up ahead, don't you worry. But anyway, stay good and I'll see you soon.
Will you send that to us?
I'll send it to you now. You happy with that?
Yeah.
That make your day? Good.
Yeah. And that's my Nathan over there.
That's your Nathan, but I don't want you to wear that out. Okay, press and play and press and play.
I've been playing this all night long.
Yeah, I'd imagine you will.
Looking at him.
Yeah.
Playing it again.
Playing it again.
Hi Chloe, Nathan here, just dropping by to say hope you're feeling okay. Listen, if you don't make
I can't believe that.
Yeah. Would you marry him, Chloe?
I wouldn't throw him out of bed for spilled milk.
That's right.
That was a great surprise.
Okay, thank you. That's it.
Do you want to go out for coffee now?
We'll go for a coffee. Yeah.
One man actually said to me, he goes, I'd much rather have a woman. Because, like, if you're a woman doing this job, like, you must be really good. And I was like, correct.
Chief maxillofacial prosthesist Niall Murphy and his team are using 3D printing technology to create a new ear for cancer survivor Tim O'Neill.
Well, from a prosthesis point of view, we make eyes, ears, noses, sometimes fingers. Everybody wants their old nose back or their old ear back. They don't really want to be faced with having to put on a prosthesis every day. That's one of the most challenging areas inside of the job that's hard to manage. That some people are delighted, some people are never quite satisfied with what they have. A person who comes in like Tim with one ear will leave here with 2 ears. And his happiness is entirely up to himself, but I try and get from my end that I've done as best for him as I could have.
Tim and his partner Kerry are travelling from Waterford to St James's Hospital. It's a big day for the couple. Today, Tim will try on a wax version of his new ear.
I'm feeling slightly nervous just because it's been in my head a lot, like thinking of, what way it's going to turn out and to be at this step is nerve-wracking, just not knowing what way it's going to turn out.
Do you want to kiss me?
Well, of course I want to kiss.
No. We'll try this ear on. Okay. So I think we'll have to bring it up. How do you think it looks? How do you think it looks?
How do you think it looks first?
Yeah, it's a bit low, I think, isn't it?
It's low, yeah. So I'll raise it up, which is okay.
Do you think?
Yeah.
Yeah, so I'll separate.
It is opposite, it's a bit low.
Okay. What do you think?
My first version was it sticks out a lot more.
This one here?
Yeah.
See, that's the way it'll be clicking on.
Okay. I'll get used to it.
Yeah. No, you get used to it, all right.
Yeah. Love this hair, look at that.
Yeah, check yours out.
It's too low.
No, but I know it's just check yourself.
I think it's a bit low.
You see that?
Yeah.
Do you think they're the same height?
I still think it's a bit low.
Did you think it was massively off? Or did you think
I thought it was, yeah. But,
Did you?
yeah.
It is. It's so many different transformations that you have to like constantly like get used to one thing, get used to another thing, and then another thing again.
Processing it, looking at it, and just it's very hard to process myself, to be honest.
Oh, I am coming into you yet. Don't worry about that. I've 3 missed calls. Yeah, she's waiting. Now, you're not coming in. I'm waiting on you. Ring me. And another message, ring me.
Chloe Podreski is one of the hospital's longest stay patients.
How are you, Miss Chloe?
Good, how are you?
I'm very good. Are things good?
Any news?
Nothing news? No.
Any news with you?
No, not since I saw you last and since I spoke to you about 20 times today.
Chloe has reached day 365 on the isolation ward. She's not responding well to her stem cell transplant.
At this stage, her platelets should be 150, 160. Chloe's are hovering around 15 or 20. She isn't responding the way they'd want it, and really they think the best thing for Chloe would be palliative care.
Your dress is lovely, Sarah.
Thank you. The DVD.
It's gorgeous.
So her chances of surviving now are very, very slim. As she said, she needs a miracle. Eventually they'll stop her treatment because they don't want to treat her anymore, because it's kind of 1 step forward and 5 steps back, but she's never getting back to where she was initially. So I suppose Chloe will probably just go off in her sleep or with us here. Not my time.
Not my time to go.
No, no. You're a keeper.
As I say, I'm a fighter as well.
You're a fighter as well.
Yeah.
I will never cry in front of Chloe because I don't want her to know. I don't ever want her to be frightened or scared. She's probably of the impression she's getting better, although we know she's not.
Let me tell you I love you. Think about you all the time.
You know, at the moment, she's kind of, I love you, Mum, more than normal. She's very huggy and feely, so maybe in her way, she senses something just isn't right, although she's not saying it. I mean, she's just a marvellous young girl, always smiling, always a nice word to say to people. Honoured to be her mum. Imagine when you go to see him, you'll have your scarf, you'll be showing your knickers up on the stage.
I won't be showing that. I won't be showing it at the stage of the giving it to him. I'll be going, there you go. Take a pair of knickers for me.
What were you working at? You might be asking.
Supervisor, Savoy Cinema.
Oh, the Savoy Cinema. Ah, see, it's hard to meet many celebs here.
It's good to have the banter. It makes the day go quicker.
Yeah, especially the job people are great, aren't they? Yeah.
2 weeks ago, Tracie Doolin had radical surgery. In an effort to cure her cervical cancer, most of her reproductive organs were removed. Today, her consultant, Mr. Faraz, will hear her pathology results. He is hoping that Tracie's cancer has not spread beyond her cervix. If it has, Tracie will face an uncertain future.
So final histology today, please, Ken.
Okay, so Tracie Doolin radical hysterectomy. So we've examined the entire cervix.
Hey, Tracie. Hiya. How are you? Good. Listen, the result is back, and we discussed it this morning in our big meeting. Okay. So the cancer was confined to the neck of the womb. Okay. So it has not spread anywhere else, which means two things, Tracie. The first thing is there will be no need for any further treatment like radiotherapy or chemotherapy. And the second thing, yes, cancer is gone and your prognosis is fantastic.
That's brilliant. I'm so happy. Thanks very much.
We are all happy for you, Claire Tracy.
Okay, that's brilliant. So it's definitely gone.
Absolutely, yeah.
Brilliant. And so, yeah.
So listen, I'll see you tomorrow. We'll take out the catheter. I know. Take your time.
I'm so happy. Thanks so much for getting rid of the catheter.
Thank you very much for taking the phone call. Bye-bye.
Take care. Bye.
Absolutely, yeah. In any job, you always we like to succeed or successful or whatever. So yeah, you feel you beat the cancer. Cancer is gone. You're successful in your mission. So yeah, you feel happy, but you still have to do the bad calls.
At the hospital, like a mini city, it's busy and everything, different things going on all the time. It's mental. Thanks very much.
Last year, Tim O'Neill lost his left ear as a result of skin cancer. Today, 4 months after visiting the maxillofacial unit at St. James's, his new ear is ready.
This is it. I'll be walking out of here with an ear. Just a little bit of worries of what way I'm going to go out here looking, as in I don't know. Sorry, could just I don't really think I have any worries, do I? Yeah, so obviously I'm hoping that it's going to go well and everything's going to look fine, and I know you're going to be there for me to help me through the whole way again, as you have been the whole thing, and I rely on you basically to...
So, because you're going to make me cry. You can't cry on camera.
You're waiting too long. You shouldn't be waiting too long. Huh?
Feel the daggers.
How you doing?
Welcome. How's it going, man?
Not too bad, yourself?
Hi, how are you?
Slightly.
Yeah?
Don't know why.
Would you rather cameras not be there when you're trying it on for the first time?
No, I don't mind.
Sure.
Yeah. Hi.
I'm just hoping that it fits now.
No, you can't tell them apart, really, can you?
Definitely.
Oh. That was great.
That's fantastic. Yeah.
You've kept me awake for months. Honestly, anyway, I'm delighted for you. And good luck.
Thanks very much. I appreciate everything.
You're a star, but man, thank you.
Thank you so much, man. Thank you.
That's a gift that you can't really give people that often, you know? And that's what they're doing up here. They're giving people the confidence to go about their daily life and not feel like they have to be paranoid or, feel worried about what people are saying or looking at. So it feels like I've been transformed to not feel that way, and it's fantastic,